When it comes to treating anxiety disorders, benzodiazepines are often prescribed to help individuals manage their symptoms effectively. Two commonly prescribed medications in this class are diazepam and alprazolam. While they both belong to the benzodiazepine family, there are key differences between the two that patients and healthcare providers need to be aware of. Diazepam, also known by its brand name Valium, is a long-acting medication that provides both anxiolytic and muscle relaxant effects. On the other hand, alprazolam, commonly known by its brand name Xanax, is a short-acting benzodiazepine that primarily targets anxiety symptoms. Although both medications have a similar mechanism of action, their different pharmacokinetic profiles make them suitable for different situations. Diazepam is commonly prescribed for generalized anxiety disorder and muscle spasms, while alprazolam is favored for the treatment of panic disorder and acute anxiety episodes. Understanding the distinctions between diazepam and alprazolam is crucial for healthcare providers to make informed decisions when prescribing medications for anxiety disorders. By tailoring treatments to individual needs, patients can experience more effective symptom relief, leading to improved quality of life. Understanding benzodiazepines and their role in anxiety treatment. Benzodiazepines are a class of psychoactive drugs that work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. GABA is responsible for inhibiting the activity of certain brain cells, which helps reduce anxiety and promote relaxation. By increasing the inhibitory effects of GABA, benzodiazepines can calm the central nervous system and alleviate anxiety symptoms. These medications are commonly prescribed for anxiety disorders, such as generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. They can also be used to manage symptoms of other conditions, including insomnia, muscle spasms, and seizures. It's important to note that benzodiazepines are typically prescribed for short-term use due to the risk of dependence and tolerance. Long-term use may lead to physical and psychological dependence, making it challenging to discontinue the medication. Healthcare providers should carefully weigh the benefits and risks before prescribing benzodiazepines for anxiety disorders. Diazepam, an overview of the medication. Diazepam, marketed under the brand name Valium, is a widely recognized benzodiazepine medication. It is known for its long-acting properties, making it suitable for chronic anxiety conditions and muscle spasms. Diazepam works by enhancing the effects of GABA in the brain, leading to a calming and relaxing effect. It is commonly prescribed for generalized anxiety disorder, GAD, and can help alleviate symptoms such as excessive worry, restlessness, and muscle tension. Additionally, due to its muscle relaxant properties, diazepam is often used to treat muscle spasms and certain types of seizures. One of the advantages of diazepam is its long half-life, which means it stays in the body for a longer duration compared to other benzodiazepines. This allows for sustained anxiety relief throughout the day and reduces the need for frequent dosing. However, the long-acting nature of diazepam also means that it takes longer to reach peak effects compared to shorter-acting benzodiazepines. Despite its effectiveness in managing anxiety symptoms, diazepam comes with potential side effects. Some common side effects may include drowsiness, dizziness, and impaired coordination. It can also cause cognitive impairment and memory problems, particularly at higher doses or with long-term use. Healthcare providers should carefully consider these factors when prescribing diazepam to patients. Alprazolam, an overview of the medication. Alprazolam, widely known by its brand name Xanax, is a short-acting benzodiazepine primarily prescribed for the treatment of panic disorder and acute anxiety episodes. It acts quickly to provide rapid relief from anxiety symptoms, making it a popular choice for individuals who need immediate relief during panic attacks or high-stress situations. Similar to other benzodiazepines, alprazolam enhances the effects of GABA in the brain, resulting in a calming effect. It helps reduce symptoms such as racing thoughts, palpitations, and feelings of impending doom associated with panic disorder. The fast-acting nature of alprazolam makes it effective in managing acute anxiety episodes, allowing individuals to regain control and alleviate distressing symptoms. However, due to its short half-life, alprazolam may require more frequent dosing compared to diazepam. This can be a consideration when choosing between the two medications, as some individuals may prefer the convenience of longer-acting medications that require less frequent administration. Like all benzodiazepines, alprazolam carries the risk of side effects. Common side effects may include drowsiness, dizziness, and difficulty concentrating. It can also cause paradoxical reactions, such as increased anxiety or agitation in some individuals. As with any medication, healthcare providers should carefully assess the benefits and risks of alprazolam before prescribing it to patients. Comparing the efficacy of diazepam and alprazolam in treating anxiety disorders. When comparing the efficacy of diazepam and alprazolam in treating anxiety disorders, it's essential to consider the specific symptoms and conditions being targeted. Diazepam, with its long-acting properties, is often prescribed for generalized anxiety disorder, GAD. GAD is characterized by excessive and persistent worry about various aspects of life, including work, relationships, and personal health. Diazepam can help reduce the intensity and frequency of anxious thoughts, promoting a sense of calm and relaxation. Additionally, diazepam's muscle relaxant effects make it suitable for individuals experiencing muscle tension and spasms associated with anxiety. On the other hand, alprazolam is commonly used for panic disorder, a condition characterized by recurrent panic attacks. Panic attacks are sudden episodes of intense fear or discomfort accompanied by physical symptoms such as rapid heartbeat, shortness of breath, and chest pain. Alprazolam's fast-acting nature allows for immediate relief during panic attacks, helping individuals regain control and alleviate distressing symptoms. It's important to note that while both medications can effectively manage anxiety symptoms, they should be used as part of a comprehensive treatment plan that may include therapy, lifestyle modifications, and other interventions. Individual response to medication can vary, and healthcare providers should carefully monitor patients' progress and adjust treatment as necessary. Side effects and potential risks of diazepam and alprazolam. As with any medication, diazepam and alprazolam carry potential side effects and risks that healthcare providers and patients need to be aware of. Common side effects of diazepam may include drowsiness, dizziness, and impaired coordination. These effects can significantly impact daily functioning and may increase the risk of accidents, particularly when driving or operating machinery. Diazepam can also cause cognitive impairment, memory problems, and confusion, particularly at higher doses or with long-term use. Additionally, sudden discontinuation of diazepam can lead to withdrawal symptoms, including rebound anxiety, insomnia, and seizures. Therefore, it's crucial to follow a tapering schedule when discontinuing diazepam to minimize withdrawal effects. Similarly, alprazolam may cause drowsiness, dizziness, and difficulty concentrating. These effects can impair cognitive and motor function, making tasks such as driving or operating machinery unsafe. Paradoxical reactions, characterized by increased anxiety or agitation, can occur in some individuals taking alprazolam. Long-term use of alprazolam may lead to dependence and tolerance, making it challenging to discontinue the medication without experiencing withdrawal symptoms. It's important for healthcare providers to carefully monitor patients using alprazolam to prevent misuse and dependence. Both medications carry a risk of drug interactions, particularly when combined with other substances that depress the central nervous system, such as alcohol or opioids. Combining these substances can increase the sedative effects and lead to respiratory depression, coma, or even death. Healthcare providers should inquire about patients' medication history, including over-the-counter medications, supplements, and recreational drugs, to assess potential interactions and adjust treatment accordingly. Factors to consider when choosing between diazepam and alprazolam for anxiety treatment. When deciding between diazepam and alprazolam for anxiety treatment, several factors need to be considered. Specific symptoms and conditions. Diazepam is often prescribed for generalized anxiety disorder and muscle spasms, while alprazolam is favored for panic disorder and acute anxiety episodes. Understanding the primary symptoms and conditions being targeted can help guide the choice between the two medications. Duration of action. Diazepam has a longer half-life compared to alprazolam, resulting in sustained anxiety relief throughout the day. This may be beneficial for individuals who prefer less frequent dosing and consistent symptom management. On the other hand, alprazolam's shorter half-life provides rapid relief during acute anxiety episodes, making it suitable for immediate symptom relief. Individual response and preference. Each individual may respond differently to medications, and personal preferences should be taken into account. Some individuals may prefer the convenience of longer-acting medications, while others may prioritize fast-acting relief during panic attacks. Side effects and risks. The potential side effects and risks associated with each medication should be carefully considered. Healthcare providers should assess the individual's medical history, medication history, and risk factors to determine the most appropriate choice. Factors such as driving, operating machinery, and history of substance misuse should be taken into account to minimize potential harm. By considering these factors and engaging in shared decision-making with patients, healthcare providers can make informed choices when prescribing diazepam or alprazolam for anxiety treatment. Alternative treatment options for anxiety disorders. While benzodiazepines can be effective in managing anxiety symptoms, they are not the only treatment option available. In fact, due to their potential for dependence and tolerance, benzodiazepines are often reserved for short-term use or as a last resort when other treatments have not been effective. Several alternative treatment options exist for anxiety disorders, including selective serotonin reuptake inhibitors, SSRIs. SSRIs are a class of antidepressant medications commonly used to treat anxiety disorders. They work by increasing the availability of serotonin, a neurotransmitter that helps regulate mood and emotions. SSRIs are considered a first-line treatment for many anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. It helps individuals develop coping strategies and skills to manage anxiety symptoms effectively. CBT can be used as a standalone treatment or in combination with medication. Mindfulness-based stress reduction, MBSR. MBSR is a program that combines mindfulness meditation, yoga, and body awareness to reduce stress and promote relaxation. It teaches individuals to be present in the moment and cultivate a non-judgmental attitude toward their thoughts and emotions. MBSR has shown promise in reducing anxiety symptoms and improving overall well-being. Relaxation techniques. Various relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, and guided imagery, can help reduce anxiety symptoms. These techniques promote relaxation and help individuals develop a sense of calm during stressful situations. Lifestyle modifications. Engaging in regular exercise, maintaining a healthy diet, getting enough sleep, and avoiding excessive caffeine and alcohol consumption can contribute to overall well-being and reduce anxiety symptoms. It's important to discuss these alternative treatment options with a healthcare professional to determine the most appropriate approach for managing anxiety symptoms. In some cases, a combination of medication and therapy may be recommended for optimal results. The importance of consulting with a healthcare professional. Before initiating any medication for anxiety treatment, it is crucial to consult with a healthcare professional. Only a qualified healthcare provider can assess an individual's specific symptoms, medical history, and risk factors to determine the most appropriate treatment approach. Healthcare providers play a critical role in prescribing medications, monitoring treatment progress, and adjusting dosages as necessary. They can provide valuable guidance on the benefits and risks of benzodiazepines, as well as alternative treatment options. Additionally, they can address any concerns or questions patients may have and provide ongoing support throughout the treatment process. Self-medication or using medications without proper medical supervision can be dangerous and may lead to unintended consequences. It's important to prioritize open communication with healthcare providers and actively participate in shared decision-making to ensure the best possible outcomes. Personal experiences and testimonials regarding diazepam and alprazolam. Personal experiences and testimonials regarding the use of diazepam and alprazolam for anxiety treatment can provide valuable insights. However, it's essential to approach these anecdotes with caution, as individual responses to medication can vary significantly. Some individuals may report positive experiences with diazepam, highlighting its effectiveness in reducing anxiety symptoms and promoting relaxation. They may note improvements in overall well-being and quality of life. However, others may share negative experiences, such as cognitive impairment, memory problems, or difficulty discontinuing the medication due to withdrawal symptoms. Similarly, personal testimonials regarding alprazolam may reflect varying experiences. Some individuals may express gratitude for the immediate relief it provides during panic attacks, allowing them to regain control and alleviate distressing symptoms. Others may mention potential side effects, such as drowsiness or difficulty concentrating. It's important to remember that personal experiences and testimonials should not substitute professional medical advice. Each individual is unique, and medication response can vary. Healthcare providers should carefully evaluate each patient's specific needs, medical history, and risk factors to determine the most appropriate treatment approach. Conclusion: making an informed decision for anxiety treatment. When it comes to selecting a medication for anxiety treatment, Understanding the distinctions between diazepam and alprazolam is crucial. While both medications belong to the benzodiazepine family and target anxiety symptoms, their different pharmacokinetic profiles make them suitable for different situations.